The Health Secretary insists Jason Leitch is not involved in the inquiry into disgraced Dundee doctor Sam Eljamel. Former patients harmed by the surgeon were previously told the National Clinical Director would play a key role in reviewing patient care. They're questioning the impartiality of that process after it emerged Professor Leitch is still employed by NHS Tayside. Lynn Rankin reports.
We need a public inquiry.
Patients have protested at Parliament.
We've been let down.
And outside hospitals where they were harmed. They were all operated on by this man, Sam Eljamel, former head of neurosurgery at NHS Tayside, and all were left with life-changing injuries. They were finally granted a public inquiry last year and were told then that National Clinical Director Jason Leitch would play a key role in setting up reviews of their care. But it's now materialised Professor Leitch is still employed by NHS Tayside.
Absolute scandalous. We're not going to get a fair review into each patient's level of care, which they so rightly deserve. So the trust is completely gone. It was gone before anyway. I really had hoped that when we were told by Michael Matheson in September, and he assured me that there would be a robust process put in place, that it's evident it's certainly not going to be robust as far as we're concerned.
Today at Holyrood, opposition MSPs said it calls into question the independence of the public inquiry.
But as yet, there has not been a full disclosure of exactly what Professor Leitch's role has been in NHS Tayside since 2012, and whether, even on an indirect basis, there has been any activity by Professor Leitch in relation to the Eljamel case. So I wonder if I can press the Cabinet Secretary to confirm that.
He's not involved in the setting up of the independent clinical review work. That work is actually being taken forward by Professor Craig White and is at a very advanced stage. In relation to terms of employment, the National Clinical Director is employed on standard NHS consultant terms and conditions by NHS Tayside and works for the Scottish Government under a service level agreement. This is typical of the arrangements through which the Scottish Government can draw upon specialist knowledge from the NHS.
The Health Secretary confirmed that officials from Professor Leitch's department are involved in setting up one-to-one reviews, and work to appoint a chair of the public inquiry is at an advanced stage. But patients fear any involvement Professor Leitch has had has jeopardised the impartiality and independence of a process they're pinning their hopes on giving them the answers they've waited years for. Lynn Rankin, STV News.